care. So you show up and it's like, oh, you have Bell's palsy. It's not a heart attack. Here, take some prednisone, like go home. And it's like, well, no, I'm a healthy, 40 something year old male. What's causing this? Like, why aren't we going deeper to figure this out? And I'm curious as to what research you did and what you learned about Lyme during the process that most people don't know.
My middle child contracted Lyme, I think it was about 7 years ago now. And I was exposed to how the medical system works when you have an infection. First of all, it was very hard to diagnose. She had headaches. Who knows what's causing that, right? And I Googled it, I searched it, and I said it's probably Lyme disease. We took her to the emergency room, and they said, well, it might be this, it might be that, could be leukemia, whatever, but we'll do a Lyme test, okay? I think I had to insist, but they did a Lyme test. But the problem with the system was that it took 3 days to get a result that was ambiguous because it's using 1980s molecular biology technology. It's primitive. It's called a Western blot, which we don't even use anymore much. And then because it was ambiguous, the insurance company said, no, we have to have a definitive result before we start treating your daughter with antibiotics. Meanwhile, Natalie is losing her eyesight. Like you've said, you can't focus. And she got to the point where I've now been told that she had a chance of dying that was pretty high, 40, 50%. At that point, it was in her brain, and we were not treating her because the test wasn't definitive. So that was disturbing. And I also told the doctors, give me a sample of her DNA or, spinal fluid, and I've got my lab across the street. I'll go sequence the DNA and I'll find this organism if it's there. And they refused to give me a sample. So, I'm traumatized at this point as a parent. And when you're traumatized, you'd like to do something about it. And so I started a company that was a spin out of AI that we were doing in my lab. We built our own little mini supercomputer out of GPU, graphic processing units. And we were able to figure out how to find any organism in the blood of a human being. And this company now has a product that is being used, for example, by liver transplant patients that are immunocompromised because of the drugs. And we can track the infections that they have, like viruses that come out of their liver and rest of the body. So that's now a reality. It's not mainstream, but eventually it will be. And when that's possible, you go to a shop, a pharmacy, or you go to your doctor, or at home, you do an immediate test. You don't know what's causing the problem. It'll say, oh, we've detected Lyme disease. And by the way, 3 months ago, you had the rhinovirus, whatever. You can see all that stuff now. And that's going to be a world that's almost here. But when it arrives mainstream, the idea of waiting 4, 5, 6 days for a result for something that could kill you, that again is medieval science and medicine.
I'm the same way. I had to advocate for a test, and it was only actually a friend who gave me a test. My family physician wouldn't give me a Lyme disease test, despite all the symptoms that I had. Did your daughter end up taking doxycycline?
Right. It was so severe, she had to have an IV treatment for many weeks. I think it was at least 3 weeks it was delivered at home by her mom to get rid of it. How did you treat yours?
Doxycycline. Yeah. So I just did a cycle of that. It seemed to not instantly, but over a period of maybe 2 weeks, like it went back to, gradually, like I had facial paralysis on half my face. And, so it started with, I could stand again. I could open my jaw a little bit more. The last thing to come back was sort of the facial paralysis. And it was scary. It was really, and it was scary that you had to be an advocate of your own health too, in a system, which you don't know how to navigate, which I also thought, as a parent, you feel, as somebody who shows up at a merge with like a face that doesn't work, you also feel it in a different way. Is there any lifespan effect of Lyme disease after treatment?
No one knows. Don't know. Doxycycline, in my recollection, I have to check on this. People who are listening can search for this in pubmed.org. Is lifespan extending? So maybe it's a short course that you took, but maybe there's some upsides. But the problem with Lyme is, particularly if you don't get it early, it can become chronic. It lives in your joints, comes out, causes a lot of joint pain. That would be not a state that would be conducive to longevity. Any increase in chronic inflammation is anti-longevity.
I like the notion. You mentioned yoga earlier. I'm just circling back to that now, but like you sort of mentioned, well, there's exercise in terms of like lifting weights and running and exerting yourself that way, but there's also